All right, we're on recording now.
All right, welcome to Return Demo Video. Right now we're talking our way through the IV and piggyback return demo skill. The PN program combines the two skill checklists, so you should have with you something called administration of an intravenous piggyback medication and replacement of intravenous tubing and intravenous solution. Now, as you know, with the return demos, you walk into one room and you do your thing. So what we're going to have you do is, when you're at the med cart in the med room, you'll consider yourself, in the return room, you'll consider yourself to be in the med room. Then once you do everything that you need to do at the med cart, you'll just simply go around the table and illustrate your entry into a patient's room. So what you'll need to do at the med cart in order to make this work, and the reason for all of this is that we cannot infuse real solution into these mannequins. We did that last year and we made a huge mess. So we're trying to avoid that this year. So the main skills that you need to be able to demonstrate in this are that you can correctly choose your primary solution, correctly choose your piggyback solution, and then you'll choose the proper tubing. Your bag probably will look something like this, or maybe a liter size. That's your primary. Your secondary will have a label on this. You'll have to read that label and choose the correct medication. You'll have to have tubing labels for the date. You'll have to either have tape or a strip so that you can label your primary bag. It's called a timing strip. You'll get the instruction on that in class. And then you'll have to be able to choose the two proper tubings that you need, the primary tubing and the secondary tubing. And we'll talk through all of that. In the med room is where you'll choose, after looking at the order and looking at the MAR, that's where you're going to choose the proper tubing and medications. Then you'll walk over to your hooks. You'll spike your bags in proper fashion, you'll prime your tubing in proper fashion, and you'll set your rates at proper rates according to the return demo sheet. The primary will be set at 20 drops per minute, and the secondary will be set at 40 drops per minute. And we'll show you how to do that here shortly. Your solutions will drip into a garbage bag. That's the safest way for us to handle this, since we can't actually infuse into our mannequins. So you'll demonstrate setting the primary, you'll demonstrate setting the secondary while the tubing runs into the garbage can. After you've done all that, you feel that you're done at the cart, you'll come around and we'll go to the bedside, and I'll show you that now. We're going to go around over here to the bedside, we'll knock, introduce ourselves, and do the proper things that we would do there. But that's when we will take the tube. You'll see that there's some dummy tubing. See, this is empty. So is the tubing. It's just hooked up to our mannequin. And what you'll need to do is demonstrate changing tubing without contaminating the end of the clean or the new tubing into the port that's there. So that's really what's going to happen here. Go through it for you. Time out.